My name is Kao Ye. I'm currently a high schooler going to Wana High School. So over the past year and a half, the importance of medical care has been truly thrust into the public spotlight. Getting the necessary treatment during the pandemic could mean the difference between life and death. Now, many take having healthcare and insurance for granted. However, this is not the case for millions of people. According to the US Census Bureau in 2018, only as much as 8.5% of people, or 27.5 million, did not have health insurance at any point of that year. And this percentage of people uninsured has been rising since 2016. So our current model of privatized and decentralized health insurance is unsustainable for the longevity of the nation and is a detriment to the well-being and the health of the people, as the number of people without adequate healthcare coverage continues to grow. A proposed solution to this is a single-payer universal healthcare program that is designed to decrease healthcare costs and make insurance more accessible to the general public. So, under our current organization of healthcare, when compared to that of other developed countries, people receive inadequate care while paying substantially higher prices. For example, the US spends 16.9% of their GDP on healthcare alone, compared to the OECD average of 8.8%. The OECD is the Organization for Economic Cooperation and Development, and is a collection of developed nations. So it's a good metric to use when comparing subjects like healthcare. On average, Americans are expected to spend almost double their GDP on healthcare compared to other developed nations. This greater allocation of annual GDP on healthcare leaves less for resources for the nation to spend on other necessities, such as infrastructure, education, and other important programs. This lack of funds decreases the overall quality of life in America, as different areas continue to suffer and deteriorate without the necessary capital to keep up with growths in population and advancements in technology. Now, one would think that with this unusually high cost of healthcare, people would receive the best quality of care and enjoy the most comfortable living conditions, medically speaking. However, when analyzing compiled data, the Commonwealth Fund notes that despite the highest spending, Americans actually experience the worst health outcomes than compared to their international peers. For example, life expectancy in the US was a measly 78.6 years in 2017, which is 2 years lower than the OECD average of 80.7. In addition to this, the US also had the highest number of avoidable deaths per 100,000 people at 112 deaths, compared to the 86 of Germany, which is the next highest in avoidable deaths of the OECD nations. People living in America, although spending the greatest amount of their money on healthcare, receive by far the worst quality of care comparatively. Now, this is where the proposed single-payer universal healthcare plan comes in, which aims to provide Americans with effective health coverage. Presently, according to the US Census Bureau, 16.3% of adults living below the poverty line and 11% of adults just living just above the poverty line did not have insurance. In addition, if we were only to look at states which do not have Medicaid expansion, this number jumps to a staggering 35.6% for those living below the poverty line and 21% for those living just above the poverty line. In the current healthcare system, not everyone receives equal access. In fact, it is those that are most impoverished and most in need that are the ones who are most often denied access to essential medical care. Many of those living in poverty do not have the financial means to afford health insurance, meaning that if a medical emergency were to arise, they would have to pay outrageous prices just to receive life-saving procedures. This would not only impact their health, this would also decrease their means to acquire other basic necessities, such as food, running water, or electricity. So a solution to this crisis is, or at least a proposed solution, is Medicare for All, which aims to expand the current Medicare system to apply and aid all people, creating a universal healthcare plan that would offer medical insurance without premiums, deductibles, or out-of-pocket expenses. This plan would effectively open health coverage up to the tens of millions of people who do not have insurance, and would also eliminate a large financial burden placed on them. The looming threat of encountering a healthcare emergency and acquiring tens or even hundreds of thousands of dollars of medical debt as a result of not being able to afford insurance. Now, what we are talking about is all theoretical, but if you were to look for a real world example of the successes in transitioning to this type of healthcare program, we need to look no further than our neighbor Canada. The Canada Healthcare Act, which was passed in 1984, established many criteria for the portability, the accessibility, the universality, the comprehensiveness, and public administration of Canadian healthcare. Under this act, Canada established provincial and territorial single-payer models guaranteeing every citizen the right to receive adequate and accessible healthcare. This had a large immediate effect on the well-being of the nation and its people, which improved dramatically. And since 1984 to the present day, every Canadian, regardless of their economic status or social class, has been guaranteed the right to medical insurance and essential health services, which has greatly increased their quality of life while decreasing their overall healthcare costs. Canadians only spend 10.7% of their GDP on healthcare, which is 6.2% less than the US, while boasting a life expectancy of 82 years, which is 3.5 years greater than the US, and only having 72 avoidable deaths per 100,000 people, which is 40 less than the US. Canada, even with a healthcare structure that requires all territories and provinces to provide every Canadian with medical insurance, spends a relatively low percentage of their GDP on healthcare, while presenting a considerably higher life expectancy and low amounts of avoidable deaths when compared to the US, but even when compared to other developed nations. Canada's system of healthcare allows for the bypassing of many redundancies when dealing with medical needs, eliminating wasteful spending on administrative middlemen and the artificially high costs for treatment and services. Canada's success in providing for a better healthcare system and shows the effectiveness of single-payer healthcare plans. Now, many opponents will bring up that the implementation of this type of system is very costly for both the nation and for private individuals. There are estimates that the 10-year spending of such a program would range from $32 trillion to $44 trillion. However, this view does not present the whole picture of the situation. In a meta-analysis of 90 studies and 22 proposed single-payer models, concluded that the implementation of single-payer healthcare would see savings exceeding the cost of the implementation of these systems. Initially, there is speculated to be about a 3 to 4% net reduction in costs, which is likely to grow over time. In addition, this plan would decrease consumer spending on healthcare by between 3 to 27%, from simplified payment administrations to real reduction to drug costs. Under a government-funded system, though the monetary expenses of US healthcare system is likely to increase in order to fund this type of plan, because of the savings associated in the streamlining of the system and lowering of drug prices and treatment prices, the increase in costs is predicted to be counteracted and even exceeded by the total in consumer and national spending. Furthermore, not only would medical care become cheaper, there would also be an increase in the amount of lives saved. According to a Lancet study conducted in 2020, it was found that implementing a single-payer healthcare system in the US would save 68,000 lives and 1.73 million life years annually. I think this is perhaps the greatest achievement and improvement of this type of plan. The main goal of any healthcare system is to save lives. And if the number of lives that can be saved through the implementation of this type of system will increase and more people will get to see through their medical issues and health problems, then we should strive to accomplish this type of goal. Thank you.